Hello, my name is Alice Simnicianu, and I work in WHO as an infection control specialist. One of my roles is in capacity building in the WHO Health Emergencies Program. Today, I would like to take you through Module 1, looking at the WHO guidance on mask use in the context of COVID-19. Today's course has 3 parts. Module 1 covers the background of transmission, the overview of the guidance, the overview of masks and mask management, mask use and incorrect use, and the recommended fabric mask compositions. Module 2 will look at mask use specifically in healthcare settings, and Module 3 will look at mask use specifically in community settings and in specific groups. What you will learn in this module is how to describe how SARS-CoV-2 is spread and the recommended measures to prevent its spread. To define the mask guidance content, describe how to use a mask safely, describe what types of masks to use, and when to use these masks. First, let's talk about the transmission of SARS-CoV-2 and public health measures. It has been a year since the SARS-CoV-2 virus was first detected, and what we know and suspect is that COVID-19 primarily spreads directly from one person to another by respiratory droplets. How large these droplets are, how far they travel, and how long they live on surfaces is still a matter for discussion and is still to be studied. There are also other routes of transmission which we will not cover for the purpose of discussing masks. In healthcare and infectious diseases, and the study of infection prevention and control, we refer to 3 types of transmission, which you see here on the slide. Most respiratory illnesses in the SARS family are described as being transmitted by droplet transmission. These droplets are said to be of various sizes, but large enough that they do not travel a large distance and fall to the ground. They are usually spread to others when you are speaking, coughing, sneezing, or singing, and within close contact with others. There is also another route of contact transmission, which is when a person is infected. The droplets containing the virus can also land on objects and surfaces around the person. Others can become infected by touching these objects or surfaces and then touching their eyes, nose, or mouth. The third transmission route we refer to as airborne transmission. This is said to be applicable for respiratory infections which are spread through small particles called aerosols that may travel and remain suspended in the air over long distances and time. In healthcare, this is mostly happening during certain procedures called aerosol-generating procedures, but may also happen in closed and crowded settings with poor ventilation, such as homes, gyms, restaurants, etc. This is why the issue of masks has become such a large topic of discussion during the pandemic, as it is one of the measures that anyone, whether you're a health worker or a general public member, can use to prevent passing an infection to others or to protect themselves from others who are infected. It also emphasizes the use of hand hygiene before we touch our face and masks. The WHO mask guidance is set up in a way that references the local transmission scenarios. So for this reason, you will need to know the amount of COVID transmission in your local setting. WHO has identified 4 transmission scenarios. The first being community transmission. This is where there is low to high incidence of locally acquired cases, which are widely dispersed in the past 14 days. There are different levels of the risk of infection for the general population, ranging from low, level 1, to very high, level 4. The second transmission scenario is called cluster transmission. This is where cases detected in the past 14 days are predominantly limited to well-defined clusters that are not directly linked to imported cases, but are linked by time, geographic location, and common exposures. It is assumed that there are a number of unidentified cases in the area. This implies a low risk of infection to others in the wider community if the exposure to these clusters is avoided. The third is called a sporadic transmission scenario. This is where cases detected in the past 14 days are all imported, or are all linked to imported or sporadic cases, and there are no clear signs of further locally acquired transmission. This implies minimal risk of infection for the general population. The fourth is a no-case transmission scenario. In this scenario, no new cases have been detected for at least 28 days, which is twice the maximum incubation period of 14 days, in the presence of a robust surveillance system. This implies a near zero risk of infection for the general population. These are the 5 recommended public health measures to prevent the spread of COVID-19. The first being physical distance of at least 1 meter distance. The second being hand hygiene. Third, respiratory hygiene. The fourth, masking. And the fifth, ensuring adequate ventilation. This is what we refer to as the chain of transmission. By looking at how an infectious disease is spread, we can understand what the measures are that we need to implement to break this chain of transmission at various parts, and how important it is to combine all of these measures, as no individual measure can stop COVID-19 in isolation. The top of the chain has the infectious agent. This is the SARS-CoV-2 virus in this case. The next link is called the reservoir. This is where the virus lives, in an infected person or on a contaminated surface. The measures to implement here are to either address and eliminate the virus on the contaminated surface by implementing cleaning and disinfecting to remove the virus, or for the individual to stop the spread of the virus by wearing a mask and staying away from others. The portal of exit is how the virus gets out of the body of an infected individual. This is through the mouth and nose when a person is speaking, coughing, sneezing, etc. The measures to block the spread from the mouth and nose to reach others are first to wear a mask to prevent the respiratory droplets from reaching others and the environment. Next is to implement hand hygiene to make sure that the virus does not reach other surfaces. The next link is the mode of transmission. This is how the virus is spread, and we've gone through it in the previous slide. We previously noted that COVID-19 is spread through droplet, contact, and airborne routes. The portal of entry is how the virus gets into the body. This is through the nose, mouth, and splashes in the eyes. The physical distance, the hand hygiene, and the mask measures at this point would address the issue of the respiratory droplets from reaching others by first blocking them at the source, at the mouth and the nose by using the mask. Next, if they do get to the hands of the infected person, the measure here would be to clean the hands and kill any virus particles with alcohol or soap and water. And finally, the distance would ensure that the droplets do not reach others because they are far apart enough from the infected individual. The next piece in the chain is the susceptible host. This is the non-infected individual who is at risk of getting sick. The measures they can do to protect themselves from others are the same. The hand hygiene to prevent any virus transmission that they can pick up from others or any surfaces, and preventing the transmission from getting to their face, and masks. The mask is another measure that they can use to protect themselves from the droplets from others. So now you see why we say that masks are just one of the pieces to the puzzle, and they cannot be used alone in preventing the transmission of COVID-19. They must be combined with all of the other measures. So now that we have learned about the importance of combining all the measures, let's talk about the masks. There are different types of masks for different purposes. The initial purpose of masks was to provide protection, protecting the person who is healthy from others around them who may be infected. Source control is the term we use to describe stopping the infection at the source, the mouth and the nose in the case of COVID. In healthcare, medical masks and respirators are used for both of these purposes, to protect the health worker and to provide source control in case they are sick. whereas fabric masks that were advised for the general public were intended to provide source control, as they vary widely in their composition and it is difficult to determine their protective value. Now we can go on to talk about the WHO mask guidance in the context of COVID-19. WHO has published the 4th edition of the mask use in the context of COVID-19 interim guidance in December of 2020. In this guidance, you can find various aspects of mask use, recommending masks in both healthcare and community settings, and the recommended composition of fabric masks. Please visit the link for more detailed information. WHO advises for the use of masks to be considered as part of a comprehensive package of prevention and control measures to limit the spread of SARS-CoV-2. The use of a mask alone, even when used correctly, is insufficient to provide an adequate level of protection or source control. Compliance with the other measures, such as hand hygiene, physical distancing, respiratory etiquette, adequate ventilation, testing, tracing, quarantine, isolation, and other infection prevention and control measures are critical as a bundle of measures to prevent human-to-human transmission of COVID-19. So what type of mask should one wear based on the WHO guidance on mask use in the context of COVID-19? There are 3 types of masks and respirators available. The first is called a respirator. You can see in the picture it is quite different from the other 2 masks. The medical mask you see here in the middle, and the non-medical mask or the fabric masks that we have seen in mostly community settings. The respirator, also referred to as N95s, FFP2, FFP3s, or equivalent types, a respirator is defined as a filtering facepiece or respirator. It offers a balance of filtration and breathability. It is intended for use in healthcare by health workers. For COVID-19, it has been recommended for health workers performing or in the settings where aerosol-generating procedures are performed. Some of its characteristics include being standardized to international or regional standards. It is used for protection and complete seal of the mucous membranes of the nose and mouth. This would require the health worker to be fit tested by the Occupational Health and Safety Department to ensure the correct size of the respirator is used. Offers at least 94% particle filtration efficiency, fluid resistance, and good breathability. The recommendations on when to wear a respirator in any COVID-19 transmission scenario are that they should be worn by health workers performing aerosol-generating procedures, or health workers who are in the same settings where these procedures are performed. It can also be used as part of PPE for additional transmission-based precautions, which we refer to as airborne precautions. Health workers may prefer to use respirators over medical masks due to their personal preference. The medical mask is defined as a surgical or procedure mask that is flat, pleated, affixed to the head with straps around the ears or behind the head. It is used for both the protection of the mucous membranes of the nose and mouth and/or source control to provide a barrier from droplets to escape to the environments around them. It's intended for use for healthcare workers, caregivers, and high-risk individuals. Some of its characteristics include being standardized to international or regional standards and offering good breathability, filtration efficiency of 95% or over, and can be fluid resistant. In any COVID-19 transmission scenario, it is recommended for health workers, people caring for suspect or confirmed cases of COVID-19 outside of health facilities, and anyone with symptoms suggestive of COVID-19, including even those who are mildly ill. The following people should wear them in areas where COVID-19 is spreading and physical distancing of at least 1 meter cannot be achieved. This high-risk group includes people aged 60 and over, and people with underlying health conditions. In any COVID-19 transmission scenario, persons who are experiencing any fever or respiratory symptoms such as cough, shortness of breath, sore throat, congestion, or any of the other symptoms that are consistent with COVID-19, or for those who are awaiting results from a COVID-19 test, or for those who are positive for COVID-19 and in isolation at home or a designated setting when there are others around them. Regardless, these people should wear a medical mask when there are others around them. The non-medical mask, also referred to as a fabric mask, is a cover for the nose and mouth. It can be homemade or manufactured, usually from a combination of fabrics and layers. It is intended for use in public as source control, to provide a barrier to prevent droplet transmission from the wearer to others and the environment. Its characteristics include that it is not standardized to any predetermined standards. It may vary according to the number of layers, their composition, breathability, droplet filtration, and fit. The WHO advises that a fabric mask should ideally consist of 3 layers of fabric. This will be covered later in this module. So who should wear a fabric mask? In the transmission scenario where there are known or suspected community or cluster transmission of SARS-CoV-2 and where ventilation is known to be poor or unknown, regardless of physical distancing, the general public should wear a fabric mask. They're also advised for essential workers who cannot maintain distance from the public, such as cashiers or servers, as well as those in public settings who cannot maintain distance from others when they are taking public transport such as buses, metro, planes, and attending mass gatherings. So what types of masks are not indicated for the protection against COVID-19? An example of this is masks with valves. We've seen certain masks with valves or vents, and these are not recommended because they allow respiratory droplets, which may contain virus, to be exhaled through the valve. They don't prevent transmission from the wearer to others. And when the use of masks is advised, we advise the public to either wear a fabric mask if you are healthy or a medical mask if otherwise indicated. So now let's talk about how to wear a mask properly. There are videos online on the WHO website on how to put on and remove and discard of a fabric mask and a medical mask. The link in this slide can be found on the website and can take you to these videos. It is important to note that mask wearing should be combined with hand hygiene at all times. As you see from the image and the list here on the slide, you must always clean your hands before you come into contact with the mask and afterwards. For example, before you put on the mask, anytime you go to touch the mask to adjust it, anytime you go to remove the mask, it is important to clean your hands. The reason behind why we advise hand hygiene to be combined with mask wearing and mask touching is that you can pick up virus or any other germs from the environment around you and place them on your mask if you are touching your mask and your face. This brings any virus or germs to your mask and your face and can cause you to get infected. It is important to find a mask that fits above your nose, mouth, and below the chin and does not have any gaps around the nose or on the sides. This is to prevent any particles from getting in or around the mask. Change your mask when it becomes dirty, soiled, or wet to prevent contamination. Looking at these pictures, what is wrong with the way that people are wearing masks? Can you identify some practices that we would not recommend? I'll give you a few seconds to look it over. The picture on the left is in a healthcare setting, and the one on the right is in a common community setting. So the first one, here are some practices to avoid when wearing a mask. First, we see they are wearing 2 masks, also referred to as double masking. This is not advised because adding one mask over another can actually make it harder to breathe, and the combination is more complicated to safely put on and take off, increasing your risk of self-contamination. It may also be difficult to get a good seal around your face with the bulk of 2 masks. Also, using 2 masks adds to the environmental burden and may take away supplies from other communities that may need them, such as health workers. You may also see the crossing of the straps in this photo. This is not recommended. The mask should ideally be worn with straps straight around the ears or tied at the back of the head, as was initially intended by the design of the mask. Some people have also been seen wearing the mask hanging from their ear or under their chin. This is not ideal and may allow the mask to be contaminated before it goes on your face again. For this same reason, it is not advised to store the mask in your pocket or on a table. Instead, it should be stored in a plastic bag or container that can regularly be cleaned. Additionally, the mask should stay on the face for the activity that it was intended for and should not be taken off to speak to others or on the phone. In the second picture, you may have noticed the gentleman on the left has his mask below his nose and below his mouth. The mask is intended to cover the nose, mouth, and chin. This is to prevent droplets from the nose and mouth to being exhaled to others around them. Wearing the mask under the chin can also lead to contaminating the mask, and it does not provide coverage to the nose and the mouth as was originally intended. It is not recommended in any circumstance. You should also ensure that you are cleaning your hands before touching your mask, whether it is to place it on or adjust it or remove it. When not using the mask, do not place it on a table or a chair. Rather, it is recommended to place it in a plastic bag or container or hung from something that does not touch the material of the mask. On the WHO webpage for masks, you can also find some nice infographics that were intended to teach about the do's and don'ts of mask wearing. Here are some examples of what not to do for medical masks and fabric masks. It is important to always combine keeping your hands clean and wearing a mask. And don't forget to continue to keep your distance from others even when you are wearing a mask. Make sure you combine all the measures to decrease your risk of getting infected and to prevent transmission to others. The next slide will go over the WHO guidelines for making your own 3-layer fabric mask. More information is available in the guidance about how you can make your own fabric mask or for manufacturers. Research has shown that there should ideally be 3 layers of a fabric mask. An innermost layer consisting of a hydrophilic material such as a cotton or cotton blend to be water absorbent and absorb the droplets coming out of the nose or the mouth. The middle layer should be made of a hydrophobic synthetic material such as spunbound. And the outermost layer should also be a hydrophobic material made of a hydrophobic material such as a polyester. For more details, please visit the guidance. There is a WHO website specifically on mask use, where you can find lots of mask resources, such as the guidance that I'm referring to, the videos, and all of the tools and resources and infographics on the do's and don'ts of how to wear masks safely, as well as any other mask material and questions and answers. So now that we've learned about masks, I want you to remember to always combine the mask wearing with physical distancing, hand hygiene, respiratory hygiene, and ensuring adequate ventilation in all of the settings that you are visiting. As you have learned, it is important to combine all of these measures as they each have a specific focus in the prevention of COVID-19 transmission. Here are some additional resources and videos that I've made mention to in this module. Thank you for listening, and proceed to Module 2 for healthcare settings or Module 3 for community settings.